everyone, this is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be talking about true deep spine muscles, two of which are known as Longissimus Cervicis, which starts at roughly T7, T8, and connects at C6, C7. That's Longissimus Cervicis. Next is its continuation that comes off of T1 and goes up to the base of the skull on the mastoid process called Longissimus Capitis. So Longissimus Cervicis, Longissimus Capitis. How can we release these muscles and where do they cause pain? Well, they will cause pain just off to the side of the spine. It can cause pain up to the side of the back of the neck and even up to the base of the skull. Anytime these muscles are under chronic tension for prolonged periods of time, this can bring on pain in the Longissimus Cervicis and the Longissimus Capitis. How can we release or mobilize these muscles? These muscles are deep to the shoulder blade muscles. So we must relax the shoulder blade muscles like upper trapezius and rhomboid to go deeper into the spine. You'll almost feel like you're on the bone. So I'm finding the spinous process, the bump in the middle of my back, going just to the side of that to hit the left one. I'm also starting in the shoulder blade region because this muscle lives at roughly T7, T8, just off to the side of that vertebrae. I'm relaxing down deep, and I can feel a rather intense, painful area where I have my small mobility ball doing a trigger point release. This is where people will ask the massage therapist to work deeper into their spine. I have found that gently rotating or tilting the body to let the ball sink in deeper can get deeper. Also, if you know that you're on Longissimus Cervicis, pain can radiate up to the base of the neck, where if I'm higher on Longissimus Capitis, roughly T1 area, just to the side of it, I can feel it radiate up higher in the neck, even to the base of the skull. Because these muscles are so deep, they often lend themselves to be treated better with techniques like dry needling. However, I can use self-care mobility to let the ball sink through the superficial muscles to get down to the deeper muscles. These are true spine muscles, not shoulder blade muscles. After I spend some time with trigger point release, I then want to do active contract relax of these muscles. This can be best done with a classic movement in yoga known as cat-cow. Whenever I round my upper mid-back, so I can change the force of where I'm releasing or stretching in between my shoulder blades by rounding out my shoulder blades, positioning my body in different directions to target between the shoulder blades. Once you feel this, let your breath do the work. Also, my chin is tucked to my sternum or chest. I can bias one Longissimus Capitis and Cervicis by looking down and away to the opposite armpit or to the other side. These muscles take time to relax and relieve. You have to feel the ribs expand in your upper mid-back and base of neck for several relaxed breaths, or they will not release. And in fact, you can make it worse or cause more pain by trying to rush this release exercise. So when I find mine, I'm holding for several deep breaths. Remember, this muscle starts on the bone, way down deep. And then the Longissimus Capitis goes to the base of the skull. I can now contract them by extending the head and neck and upper mid-back to do audiogenic inhibition, followed by rounding out my back to contract chest muscles and upper front body muscles and shoulder blade muscles to do reciprocal inhibition. Little subtle tilts and turns of head and neck allows you to tease out the little crooks and crannies of the body deeper into the body. And this will take, on a starting dose, anywhere between 5 to 10 breaths, 2 to 3 times. If you are really tense and tight on the deep spine muscles, it may take even longer. I do this exercise daily as part of prophylactic head and neck and upper mid-back pain relief. You can also do this at least once or twice a week, but this is really a movement that we should all have in our lives each and every day for general spine health. If you've liked this video, please hit the like button, the subscribe button, and please share this video with your friends and family, because not everybody has heard of the Longissimus Capitis and Longissimus Cervicis. What a name. I wish you all a great day, and I look forward to seeing you again soon. Take care.